Hello, my name is Jennifer Quiogue, and I am a psychiatric mental health nurse practitioner student at Eastern Kentucky University. This semester, my learning has focused on a problem relevant to my future area of advanced nursing practice and reviewing literature that provides evidence to support a specific chosen intervention. The problem I chose is medication adherence. Medication adherence is defined as taking the prescribed dose of medication at the prescribed frequency. According to the Center for Disease Control and Prevention's 2017 estimates, 1/2 of the U.S. population discontinues their medication use within a year of it being prescribed. The chosen population is adults with chronic illness such as heart disease, diabetes, and depression. And the chosen intervention is motivational interviewing, which I will refer to as MI and will discuss more in depth later in this presentation. So why is medication adherence important in adults with chronic illness? Chronic illness accounts for 86% of our healthcare costs, and 7 out of every 10 deaths is due to chronic illness. Poor medication adherence has been linked to poor outcomes and up to a 69% increase in hospital admission rates among adults with chronic illness. There's also avoidable healthcare costs that are estimated to be between $100 and $300 billion that are associated with non-adherence to medication. These statistics help to highlight the importance of this problem not only to healthcare professionals, but to patients, their families, and to our nation. So for this study, there were 2 randomized controlled trials that were selected for review. For this assignment. The first study looked at utilizing MI to improve medication adherence among Latinos who were taking antidepressants. A total of 50 participants were selected from a community mental health center and randomized into 2 groups. There was the control group that received care as usual, and then the meta group. Meta stands for Motivational Enhancement Therapy for Antidepressants, and this is based on MI principles. The meta group received intervention, which was an individualized 60-minute session utilizing MI that was delivered in the patient's language of choice, and this occurred at 5 weeks and 5 months. Medication adherence was measured both objectively and subjectively. Objectively through the use of medication event monitoring system, which measures the number of times a pill bottle is opened, and then subjectively with the self-reported medication taking scale. Findings from this study showed statistically significant higher levels of medication adherence among meta participants at both 5 weeks and 5 months, per the means and self-report. The second study examined the effect of MI on medication adherence to antiplatelets following a coronary stent placement among racial minorities. A total of 452 participants were identified through Humana's electronic data warehouse who met the criteria and then were randomized into 2 groups. One group was the MINT group, or Motivational Interviewing Group, and the second group was an active control group that received a mailed DVD as long as quarterly mailings. Only 51% of the DVD participants actually viewed the DVD, and statistical analysis showed no significant difference in outcomes among the DVD group participants who viewed the DVD and who did not. MINT group members received a phone call every 3 months over the course of 12 months, which accounted for 4 telephone calls. These calls were made by a nurse who used MI as the framework for conversation and addressing medication adherence. Medication adherence was measured objectively through the medication possession ratio, or MPR. This is a pharmacy claims-based measurement. And then it was also measured subjectively through the Moriski Medication Adherence Scale, which is a self-reported scale. The MPR was collected following the study, and the self-report scale was administered at each phone call. Findings showed statistically significant higher levels of medication adherence among the MINT group participants per both the MPR and self-report. These 2 studies both included MI as the intervention to improve medication adherence. They were both randomized controlled trials, which provide a high level of evidence showing that the intervention links to the outcome of improved medication adherence. And both studies produced statistically significant results. Adherence was measured both objectively and subjectively. And there is further literature that supports the use of motivational interviewing to improve medication adherence. For those of you who are not familiar with MI, I have included some brief information regarding basic principles. MI is a patient-centered framework for conversation that is goal-oriented and collaborative. The focus is on enhancing personal intrinsic motivation for positive behavior change, and it takes into account the patient's experiences, values, and expertise. And also, MI really tries to avoid confrontation with the patient that you're working with. While becoming proficient in MI does take some training and practice, this content is easily accessible on the internet and training is not extensive. As a future psychiatric mental health nurse practitioner, I plan to practice in an outpatient setting. In this type of setting, the advanced practice nurse typically sees patients weekly, bi-weekly, or monthly. This allows the opportunity for brief motivational interviewing, as well as follow-up to evaluate effectiveness. I propose that advanced practice nurses use brief motivational interviewing in a psychiatric outpatient clinic setting as an intervention to improve medication adherence, as evidence exists that this is effective. So thank you for taking time to view my presentation. And if you would like more information on the studies reviewed that support MI in practice, please view the reference list on the end of the PowerPoint. Thank you.